TC4-02.1 First Aid. Purpose. TC4-02.1 provides first aid techniques for non-medical soldiers to use in both tactical and non-tactical environments. Key objective: equip soldiers with skills to stabilize casualties until professional medical care is available. Categories of first aid: self-aid, buddy aid, combat, lifesaver, aid. Key fundamentals of first aid. Terminology: CASEVAC, casualty evacuation without medical care en route. MEDEVAC, medical evacuation with en route care. Combat lifesaver, a soldier trained in advanced first aid procedures. Tactical combat casualty care, TCCC, prehospital care in tactical environments, including care under fire, tactical field care, tactical evacuation care, vital body systems, respiratory system, delivers oxygen to the body. Circulatory system, transports oxygen and nutrients via blood. Musculoskeletal system, provides structural support and mobility. General principles: assess the situation carefully to ensure responder and casualty safety. Avoid moving casualties unless there is an immediate threat, e.g., fire, further injury. Key first aid tasks: evaluate a casualty. Assess consciousness using AVPU, alert, verbal response, pain response, unresponsive. Identify life-threatening injuries like severe bleeding or airway obstructions. Open the airway. Use the head tilt, chin lift, or jaw thrust method. Check for breathing by look, listen, and feel. Control bleeding. Methods include direct pressure, pressure dressing tourniquet application, used for life-threatening bleeding. Treat for shock. Symptoms: pale, clammy skin, rapid breathing, confusion. Treatment: lay casualty on their back and elevate legs. Loosen restrictive clothing and maintain warmth. Perform first aid for burns. Remove casualty from the source of burns. Types of burns: thermal, chemical, electrical, and laser. Avoid applying ointments, breaking blisters, or pulling off stuck clothing. Treat heat and cold injuries. Heat injuries. Symptoms include dehydration, confusion, and cramps. Cold injuries. Includes frostbite and hypothermia. Keep casualty warm and dry. Address specific injuries. Chest wounds. Use an occlusive dressing. Nerve agent exposure. Administer antidotes and seek immediate evacuation. Bites and stings. Remove stingers. Clean wounds, and monitor for allergic reactions. Questions and answers for Army Promotion Board. General First Aid. Questions: what is the purpose of first aid in the Army? To stabilize the casualty and prevent further injury until professional medical care arrives. What are the three categories of first aid? Self-aid, buddy aid, and combat lifesaver aid. What does TCCC stand for? Tactical Combat Casualty Care. What are the three phases of TCCC? Care under fire, tactical field care, and tactical evacuation care. Evaluation and airway management. What is the AVPU scale? A method to assess consciousness: alert, verbal response, pain response, unresponsive. What are the methods to open an airway? Head tilt, chin lift, and jaw thrust, for suspected spinal injuries. How do you check if a casualty is breathing? Look for chest rise, listen for air movement, and feel for breath on your cheek. Bleeding and shock. What are the methods to control bleeding? Direct pressure, pressure dressing, and tourniquet application. When should a tourniquet be applied? For life-threatening bleeding that cannot be controlled by other means. What are the signs of shock? Pale, clammy skin, rapid breathing, confusion, and restlessness. Burns and heat, cold injuries. What are the types of burns? Thermal, electrical, chemical, and laser burns. What should you not do when treating burns? Do not apply ointments, break blisters, or remove stuck clothing. What are the symptoms of heat exhaustion? Dizziness, excessive sweating, and nausea. What are the signs of frostbite? Numbness, pale skin, and a waxy appearance. Casualty evacuation. What is the difference between CASEVAC and MEDEVAC? CASEVAC involves transportation without en route medical care, while MEDEVAC includes medical care during transport. What is the purpose of the 9-line MEDEVAC request? to request timely evacuation and medical support. Practical scenario. Questions. How do you treat a casualty with a chest wound? Apply an occlusive dressing, monitor for respiratory distress, and seek medical aid. What do you do if a casualty is choking? Perform abdominal or chest thrusts to clear the airway. How do you assess for and treat a fractured limb? Immobilize the limb using a splint and secure it to prevent movement. What steps do you take for a nerve agent casualty? Administer antidote injections, if trained, and evacuate immediately.